Okay, so I am going to get started here. This presentation is called Hope for Hormones, and I have a huge love for this topic for several reasons, which we'll get into. But I am excited. I love to talk about hormones. So, within this, as people come on and join, I'm sure there'll be some stragglers. I'll have you guys just hop in the chat and let me know that you're here. Okay, so let's start out with a case study. So 24-year-old fertility patient, brain fog, joint pain, irregular periods, diagnosed PCOS, suspected endo, extremely painful periods, and fatigue. So this is a type of case study that we'll kind of use and go back to throughout this presentation. So this is what is called a Dutch test, and I absolutely love the Dutch test because it shows us something that blood hormones cannot. Actually, a few things that blood hormones cannot. It shows us the actual breakdown in our estrogens. So if you've ever been told that estrogen is a hormone, you've been lied to. It is not. It is a group of hormones, estrogens, and there are actually about 11 of them. So we haven't even been able to figure out how to see all of them. But these are the main ones here. So there's, as you see, 7 here. And so we see how the body actually is able to break down hormone and utilize it and then get it out of the body. So really, really important information here. So this is the Dutch test of that 24-year-old fertility patient. So where did things go so wrong? What is expected of our hormones? So conception, birth, puberty, adulthood, and menopause, right? And these things are all supposed to be so picture perfect, except they're really not, right? So conception today has got more and more difficult. We're using more IUI and IVF than ever before. So this is the reality. Birth, there are more C-sections and assisted births than ever before. When puberty hits, they have more painful periods, more PMS symptoms than ever before. So a lot of girls go on birth control right away. And in adulthood, it's really hard to conceive, right? And then, we hit those menopause years and we're like, all right, let's get rid of our uterus. And then we die, right? Nice. All right, so for those of you who don't know, hormones change throughout the lifespan. So in your childhood years, you have a very low amount of hormone. When you hit puberty, it goes up, and then it cycles every month, right? So it goes up and down, up and down, up and down in a cycle. Then in our menopause years, we have more hormone than we had in our childhood years, but it's pretty stable. So hormones are stealing our girls. The average age of menstruation is now 12 years old. So back in the more like the 1950s, 1960s, that was actually more like 16, 17. So if you don't think hormones added to our meats and our milk and all of that stuff isn't affecting us, this will tell you differently. And childhood obesity is on the rise. This also affects when we get our cycles. So we've come to expect abnormal cycles, right? At least 30% of women have irregular cycles. 80% of women report having undesirable symptoms during a period, and 84% of women report having painful cycles. That is a lot. And you guys, that is not normal. It's super common, but it isn't normal. So we had a 14-year-old come in with anxiety issues. She was just so anxious about everything. Like, she had some little bumps on her skin. I don't even think it was acne. It was just more of like a rash. And this was like the detriment of her. Like, she was just going crazy. Like, every little thing was bothering her. And so we did some hormone testing, and this estradiol was off the chart. So you guys can see a 433. We did time this during the luteal phase, so it should be anywhere between a 55 and a 214. So this is more than double of the top of the range. So yes, anxiety can lead, or hormone imbalances, excuse me, can lead to anxiety. Okay, so some of those high estrogen levels are significantly associated with anxiety like behaviors in some studies. Common hormonal issues. Okay, here they are, you guys, and look at the percentages. So PCOS, most common cause of infertility. Endometriosis, between 10 and 20% of cycling women. PMS and PMDD, 20 to 30%. So those of you who don't know what PMDD is, it's like an extreme premenstrual disorder, okay? Lack of sex drive, 43%. Fibroids, 80% by the age of 50, which kills me. Infertility, 1 in 6 couples, and I believe it's actually more like 1 in 4 or 1 in 5 now, and horrible menopause. So let's talk about birth control. 62% of women of reproductive age are on hormonal birth control. 4 out of 5 sexually active women have been on the pill at some point. So let's look at why we are actually using birth control. We have found that it's not actually for birth control much of the time. It's actually for painful cycles, to regulate cycles, which is actually kind of crazy when you understand how birth control works. 14% for acne and 4% for endometriosis. 11% is for unspecified reasons. So birth control, you guys, for those of you who don't understand how this works, it is a synthetic form of estrogen and progestin. And so this kind of tricks your body into thinking that it doesn't need to ovulate. And so because your hormones are artificially high already. Okay? So this does not regulate your cycle because it is actually crashing your hormones down to nothing. So it doesn't actually regulate them. Okay? It can, by the off chance, sometimes people come off of birth control and their periods do regulate, but that isn't because of the birth control. Okay, so what we know about birth control is it is an endocrine disruptor. Okay, so in the last 2 decades, there's been a growing awareness of the possible adverse effects in human wildlife exposure to chemicals that interfere with the endocrine system. Developmental malformations, interference with reproduction, increased cancer risk, disturbances in the immune and nervous system function. You guys, we know, like, birth control is a hormone disruptor. It's an endocrine disruptor, 100%, okay? That even, like, the medical system will even tell you that, okay? So that's what it is. So how birth control works. Okay, so there's a couple different types. There's the progestin only, and then there's a combo of estrogen and progestin. So when they just used high doses of progestin, there was a lot of breakthrough bleeding. So in that manufacturing, estrogen actually happened to get into some of the pills, and they realized that there was no more breakthrough bleeding, and so they decided to add these phytoestrogens. Okay, these are labs on birth control. Take a look at that. No progesterone, almost no pregnenolone, and extremely low estradiol. Even that DHEA is low. Like, this person has pretty much no hormone because that pill is tricking their system into thinking that it's making a lot. So labs not on birth control, no birth control, right? Look at that progesterone. You guys, progesterone is so vitally important for our bodies. I cannot tell you how many people who don't have progesterone feel horrible, and when they start to get progesterone, feel so much more amazing. It actually even makes you look younger. That's part of the pregnancy glow. When you see somebody who's pregnant and you're like, wow, they look so beautiful. Their skin is glowing. Oh my goodness. That is in part due to progesterone. So this is what your hormones should look like. It's actually a lot more complicated than we think it is, right? And this isn't even the whole thing. This isn't everything that goes on in the body to cycle. But you see LH and FSH up there. So those are the things that help our body send the message to our body to ovulate. And when that ovulation happens, right, we have different hormone increases. So before we ovulate, we have more of those estrogen increases. And then after we ovulate, that progesterone really starts to climb. And then the estrogens come up a little bit too. If we don't get pregnant, those all fall. The levels fall, the progesterone and the estrogens, and we get a period. If we do get pregnant, those continue to climb up. Infertility. You guys, the prevalence of infertility is staggering today. It says here 1 in 8 hearts ache for a child. We know that this is much greater. The statistic is at 1 in 6 actually right now. And then 1 in 4 is not just a statistic, it's me speak out about pregnancy loss. So I know so many people who have miscarried, and sometimes there is nothing that can be done about it, and sometimes there is, and that's the sad thing, is that we're not even doing labs to see if we could save a pregnancy. So main causes of infertility: hormone issues, and that's kind of the obvious one, metabolic problem, gut problem, immune system problem, or anatomy problem. So what is the cost of infertility? The average cost per success is almost $50,000, and this isn't even new information. So I would say that it has gone up, I'm sure, like everything else has. This is just astronomical. So if you need IVF, $61,000, that is just wild to me. You guys, my herbs and supplements and my care will never add up to that. How we're treating it, right? So we kind of just throw things at the board and see what sticks, right? So I love that one, just relax. So if you're somebody that's ever struggled with fertility and somebody's told you to just relax, that is like the most painful. It's so hard, right? And then we look at Clomid and metformin, which are medications. Clomid helps with the ovulation, and metformin is actually there to help with issues like insulin resistance, okay? And then try this next, right? IVF, and maybe we'll get there. There's no guarantee. Okay, and all that hurt and heartache hopefully leads to motherhood, right? That's the main goal for these people with infertility. We're not doing very well, right? And some of these reasons are just people financially, but I can tell you back in the 1950s, 1960s, that's when my parents grew up, and they had way less money than most of the people I talk to now. So I don't actually think that's the greatest excuse for why this is happening. I think it is, due to stress and challenges, and the fact that we just don't treat our bodies properly. So if it doesn't work, we'll just cut it out, right? And I'm 30 years old, and I actually have had friends who have already had hysterectomies prior to 30 years old, which is just wild to me, you guys, because they are getting rid of their ability to regulate hormone. Those people typically age a lot faster. The people that have early hysterectomies that I see in my office tend to have a lot more joint issues, knees, hips, shoulders. They are in pain all the time. So the way that we approach pregnancy, all right, testing. We test for major infections, vaccinations, TSH, glucose intolerance, and genetics. Those are the things that we test when somebody becomes pregnant. That is a little wild to me because that stuff is not what is going to help you get through a pregnancy. What is going to help you get through a pregnancy is making sure that you have enough hormone, making sure that your iron levels are good, making sure that your thyroid hormone is good, making sure your immune system's working properly. You have, yes, I do believe glucose is important, not being in a diabetic state and watching your diet. But look at this, you guys. So this is a 30-year-old female, 26 weeks pregnant. And so she went in and was letting her doctor know, hey, I don't feel right. I'm dizzy. I am so tired. And they're like, yeah, that's just pregnancy. It's just the way it is. So she did some testing with us, and this is what we found. Iron extremely low, ferritin extremely low, and thyroid hormone extremely low. Okay. So it's not always just, hey, it's just pregnancy, right? You are as old as your grandmother. So you may not know that before you were actually ever a thought in anyone's mind, you grew inside of your mother, who grew inside of your grandmother. So things that your grandmother did while she was pregnant with your mother may have impacted your health. How do we approach birth? Well, 32%, this is from the CDC website, of pregnancies end in a C-section. That is a staggering percentage to me. Here are the benefits of a vaginal delivery. Early contact between mom and baby can immediately initiate breastfeeding, squeezes out fluid from newborn's lungs, and there's bacterial exposure. Okay, not to mention that mom didn't just go through a major surgery. And yet 26% of the women end up with a cesarean are considered low risk. Okay, so I'm not against C-sections. However, I am against pushing them because of a timeline. So if you've never heard of something called pit to distress, when a doctor feels that things are not going fast enough, and this is just a very impatient doctor, they will push Pitocin. Pitocin will give contractions, but a lot of times what happens is that baby starts to go into distress. And because it's just not ready, it's not the body's timing, right? It's not the baby's timing. They will have to go into a C-section, even though they were considered low risk. So 32% cesarean section rate, 1 in 20 vaginal births will be assisted, vacuum delivery, or forceps. And look at our infant mortality rate. This is so disappointing to me. We are the worst of all the developed countries. We have the highest infant mortality. So six infants die per 1,000 that are born, which is just insane to me. All right, so it's no wonder that hormone problems are at an all-time high, right? And then we have menopause. It's just puberty's evil older sister. So what is a hormone? It's a chemical messenger, you guys. That's all it is. It delivers critical information to cells to keep the body healthy and functioning properly. The synthetic hormone, like birth control, interferes with a woman's ability to create her own hormone, okay? And that is considered an endocrine disruptor. There's a growing body of evidence that suggests numerous chemicals, both natural and man-made, interfere with the endocrine system, okay? So let's talk about these hormones and how they work going down the pathway. So we start with cholesterol. Oh my gosh, cholesterol, that's the worst thing ever. It's so bad for you. No, it's not. Cholesterol is 100% necessary. And if you still believe that cholesterol is bad, it is also what your brain uses, right, for food too. So people who have a very low fat diet often end up with memory loss or dementia. So that cholesterol feeds into pregnenolone, which we call our mother hormone. That hormone feeds down into progesterone and into all of our other stress and sex hormones. This is our stress pathway. This is what I see often very dysregulated in women because of stressors either within our body or from the outside world. Okay, so this is what hormone metabolism looks like. So this again is that Dutch test. And so you guys, these are just, now you'll look differently at it, right? So once you saw that hormone pathway, you start to look differently at hormones when you realize you don't just make this one, and this one, and this one, and this one. They go down a pathway. So if you don't have enough at the top, you're never going to have enough at the bottom. Oh my gosh, cortisol. So cortisol is the hormone that provides us energy throughout our day. Okay, and so if this is really, really low, like you see here, this person is just going to be dragging through their day. So if you're one of those people, you may have a cortisol issue. Okay, so our choices are medications or surgery, right? Breast cancer, medication or surgery, what do you want? So pathways are extremely important in something like fighting against breast cancer. So you guys, we can tell if the hormones are going to be a problem with creating cancer by looking at a Dutch test. You can see this pie up here. In this person, they have a lot more hormone going down this red pathway. You can see it's at they're almost at 38%. It should be between 7.5 and 11%. So what's happening there is that hormone is going down, binding to a quinone and damaging their DNA. Okay? This can cause cancer. So these two tests together, looking at blood hormone and looking at urine hormone, can really give us a good idea if you're headed down a destructive pathway. So the National Cancer Institute calculated the average cost of medical care and drugs tops $42,000 in a year following a cancer diagnosis. Some treatments can exceed $1 million. Usually, most costs are covered. This is really sad, right? Because if we were just able to do those tests on the prior page, which nobody does, we would never have to be in these chemotherapy chairs, right? It's a lot less expensive to do the hormone testing than it is to get cancer treatment. And guys, a lot less painful. What makes hormones? Okay, ovaries, adrenals, and fat tissue. Okay, so here's the thing, right? If we get rid of our ovaries, right? We have a hysterectomy or they're just not working anymore because we're postmenopausal. Our adrenal glands are tanked, which happens all the time because of stress. And the only place that we have to make hormone is now fat tissue. How easy is it going to be for us to lose weight? So what happens a lot is that women postmenopausal start to gain weight. They're like, I've been thin my whole life. I have no idea where this came from. What is going on? Well, we can explain that, right? Guys, have you ever heard of Premarin? So this is something after women get a hysterectomy. This is something that they will prescribe. It's conjugated estrogens. Do you know where it comes from? It's pregnant mare urine. So nasty. I just have to add that in because it's just disgusting. Okay, so what makes the Wellness Way so different? Well, we have this crazy idea that the body does not make mistakes. It's time to make a change. So if I took you and I put you out in the woods with no clothes on, you'd start to shiver. You'd shiver and you'd start to get frostbite, right? Because all of the blood in your body is going to your core. Okay? Is that a mistake your body's making? No, right? Because you can live without your fingers and your toes and your legs and your arms, but you can't live without your core. So your body is pushing all the blood to the center of your body to stay alive. This is not a mistake. Our body works like a Swiss watch principle, okay? So in this, we have our nervous system at the center. We have all of our other systems surrounding that. We have our nervous system at the center because that is the control center for the rest of our body. It tells everything else in our body what to do and when to do it. So if you have a nervous system issue, you are going to have an issue in somewhere else in your body, okay? You guys, do you think the digestive system could have an impact on the endocrine system? 100%, okay? So if you have an infection in your gut, you guys, how close is that to your uterus, your ovaries, your adrenal glands? It's all wrapped up in the same area, right? So we have to look at all the systems in the body, not just choose one to focus on. Okay, the fireman and carpenter principle. This explains what we do. It explains what the medical system does and when to use each one of us. So if you are on your way home and you see that your house is on fire, I hope that you call a fire department. They're going to come in and they're going to use two tools. They have a hose and an axe. They're going to start to spray water on your house to put out that fire. If they can't get it all, they're going to use their axe. They're going to chop down your front door. They're going to go in and they're going to spray water on your ceiling, your walls, and your floors. Is that water good for your ceiling, your walls, and your floors? Well, of course not, right? But it's going to put the fire out. And that at that moment, that's what you need. So they put the fire out and you're like, okay, great. Thanks. When are you coming back tomorrow to clean this up? And they're like, what? Not my job, right? So the next day, I hope you call a carpenter. And the carpenter is going to come in and hopefully I really hope that he finds what caused the fire and he fixes that. And then he rebuilds the body. Okay, so we look at the medical approach like the firemen. They are there to put out fires. They do a fantastic job. If you have a heart attack, you go to the hospital. They're going to give you an IV, first tool, and they're going to give you maybe surgery, their second tool, right? And they are going to make sure that you stay alive. That's amazing. We have an amazing medical system. The next day, they're going to send you home with a couple medications, and they're going to say, I want you to stay on this baby aspirin. I want you to stay on this, it could be a myriad of different things, but it could be a statin. It could be a blood pressure medication. I want you to stay on this for the rest of your life, right? The problem with that is that you're just watering down your house every single day instead of finding the carpenter to figure out what's really going on. So let's go through some tips. Number one, take time for self-care. Self-care is extremely important. Whatever feels good to you, as long as it's healthy, do it. Take time every day, at least 30 minutes for self-care. Tip two, nutrition. Nutrition is extremely important, and you may not realize that you're eating things that are actually harming your body. You could be allergic to cucumbers. You could be allergic to kale. Things that are supposedly so healthy for you, you may be allergic to. So getting a good idea of what your food allergies are is really important. Eat food. Maca is a superfood. It has all essentials, fat, protein, and polysaccharides. It helps increase all female hormones. I have it right here in my coffee, you guys. All of these 8 things are wonderful for hormone support. Cacao. Oh my gosh, who doesn't love chocolate, right? I'm telling you guys to eat chocolate. However, good chocolate, because all is destroyed in high heat, okay? So we want that serotonin, and we want to be able to release that oxytocin when we eat cacao. Avoid endocrine disruptors. So this is becoming more and more commonly known, right? But we have to make sure that we're avoiding these nasty things. Tip number 4, get adjusted. 1, it feels great. That little cute baby there. It feels great. And number 2, it's very important to keep your nervous system in check. Tip 5, get tested, right? So we have so many tests that are available. It's absolutely incredible. And they are nowhere near the expense of what you get at the hospital. So if you guys remember that infertility patient, that was actually me. I am the 24-year-old. I'm also the 30-year-old who was pregnant and feeling fatigued and didn't have an answer. And I conceived, and I have a beautiful daughter. She's so just amazing, super healthy. We're both so healthy now, and I really owe that all to the Wellness Way and getting my body right. And so if you're somebody who's like, I just want to do it the right way, I'm tired of taking medications, having surgeries, I'm tired of not getting the information I want, then this is for you. So our first exam for watching this presentation is only $99. And what's included is a review of past test results, full spinal x-rays if you're in the area, of course, consultation and exam. Thank you.